Some people are intimidated to come to see an orthopedic surgeon because they think all we're looking for is a surgical solution. The reality is, in my patient population, only about 25% of patients end up with surgery.
Physical therapy is something that we use quite a bit for knee injuries or knee problems.
Just about anyone's the right candidate for physical therapy. If we're talking about a knee injury or post-operative rehabilitation, we have actually even had people come in that would like to build a supplemental program in order to prevent future injury. You want to make sure that you have good foot support, as well as make sure that the hips are included in the strengthening program, because the knee is the one that takes the brunt of the force between both the hip and the foot in a lot of cases. The squat's one of the exercises that we really like to do in physical therapy. This particular exercise strengthens not only hips as well as muscles around the knee, but all around it's a good exercise to do. The most important thing about doing the squat is to make sure that the knees are not coming over the toes. He actually just gave you an example of what not to do, which is also having the center of gravity go over the toes as well as the knees. A great exercise to do is a lunge. The lunge, again, you want to keep the knee behind the toe, and we're going to take it from an anterior lunge and do multiple directions on it, the transverse plane being one of them, which is very important for functional activities. This is the lateral step down exercise. This is training your knee and the muscle to control the descent downwards, and it's what we consider an eccentric muscle contraction. And you just want to be careful to keep the hips level during this exercise so that we're making sure that the knee's doing the work.
A lot of the injuries that we see are from overuse injuries and from muscle imbalance. You don't want to just be a weekend warrior. You need to do some conditioning in your downtime.
If they have knee pain, either whether it's due to an injury or just starts spontaneously, try an over-the-counter anti-inflammatory, ice, elevate, stay off the leg. Sort of take it easy in general for 3 or 4 weeks, and if by that time you're still having the symptoms, then at that point it's a good time to see a specialist.
Not only are we specialists in movement analysis, but we also have direct access to all of the physicians. That way we can have a better understanding of exactly what each individual situation is so that we can help get you back on track and educate you on how to take care of your knees.